every time something's front and center, like a big epidemic that we're having, this coronavirus, well, I think it makes you realize that the future of healthcare belongs to telemedicine. I mean, I'm afraid to go to the doctor. I mean, why go? You're surrounded by sick people. When you get yourself diagnosed by video conference, especially these days, when I got to tell you, I think we're all pretty paranoid. And that's the thesis behind Teladoc Health, which came public nearly 5 years ago. It's since become one of the hottest stocks in the sector. You know, since the IPO, this stock is up more than 460%, including nearly 70% gain last year, 28% move for 2020. Their most recent results were terrific. They had a very upbeat presentation at JP Morgan Healthcare Conference last month. And we recently learned that Teladoc's buying InTouch Health, expanding their presence in the hospital telehealth market. We'll go over that. This thing's been on a roll. Can it maintain its momentum? Let's take a closer look with Jason Gorevic. He's the CEO of Teladoc. To learn more about where his company's headed, Mr. Gorevic, welcome back to Mad Money. Good to see you, Jason.
Thanks,
Have a
Jim.
seat.
Good to see you.
Yeah, I got to tell you, I flew down to Miami this week, and it was a question about whether for the Super Bowl. Yeah, I had the mask on for a few minutes, and I felt it was awkward because I didn't want people to say, oh, he's got a mask on. At the same time, all I really cared about was the person next to me not being sick. I don't want the person next to me at a waiting room not being sick, but it's pretty hard to avoid. Teladoc's the right thing right now.
No, that's exactly right. We enable people to get care without going where everybody's afraid to go, which is the emergency room, the doctor's office, where you're likely to get infected with something if you don't already have it.
Now, speaking of that, you're in Shanghai.
That's exactly right. Yeah,
all right.
About a quarter of our business is international.
Well, to me, if I'm in Shanghai, I want to see a doctor. Everyone tells me it's impossible to even see a doctor. They've got 3 hospitals, each have 500,000 patients. Is Shanghai let's say, the next big thing?
Well, so our team in China is on top of the spread of the coronavirus. They're in touch with our team here in the U.S. and all around the world. And we're working with the CDC, the WHO.
You are? So what's the word, man?
Well,
because, we're getting too many people who are too optimistic, I think.
Well, I think the important thing is to understand what's true and what's not true. Right? Right now, in the U.S., it's a concern more than it's a reality. Right. We want to make sure that our doctors are equipped with the right information and the screening tools to make sure they know what to look for and how to quell those fears that right now aren't materializing. And we're staying on top of what's going to change.
But if I'm on that Princess Cruise, would I call in? Could I call in?
Well, sure. Yeah, we're available all around the world. We provided care last year in 125 countries.
Shouldn't we all have a subscription just as something in our back pocket in case we think that it's something's going on?
Well, I think that's exactly right. And we're seeing more and more demand from employers, from health plans all around the world. We're working with our clients now to make our service available for their people who are on the ground in China.
Now, Lisa Gill was talking about the year of the patient, and that means the year of Teladoc. I mean, this is the year where I think the patient is sometimes, let's say, every day once because they watch the news. I mean, can you check in every day if you're a subscriber?
Well, sure. And in fact, we have, for example, mental health care services, which is an unlimited subscription where you have a relationship with a therapist and have access through chat, text, phone, video on an unlimited basis.
And I saw the pricing for some of these features is dramatically lower than if you saw a person of similar quality individually.
Well, that's right. And I think quality is the most important thing there, right? All vetted, making sure that it's the right quality medicine, all on a single platform so that we can standardize the delivery of care. And then, as you say, it's just a more efficient way to deliver care.
Now, this flu season in itself, forget the corona, it's been terrible. Where are your doctors on top of that? How many more calls have you had? Is that a big, so to speak? I know you don't. I know you're a good guy, so you don't have to say, "Listen, we kill it in the flu season." But obviously, this is something that motivates people to subscribe.
Well, certainly. And there are examples of where state health departments have advised telemedicine so that you're not going into a doctor's office or an emergency room and infecting other people. But, certainly our volume is up. And and this is a much more severe flu season than we had last year. And what used to be, us doing high fives when we had a $10,000 visit day is now a normal Tuesday for us.
Wow. Okay, so how about your deal with Aetna? Because we had Larry on, Larry Merlot, and he's got these clinics, so to speak, in the stores. Aren't they competing with you?
Well, no, actually, we partner with Aetna, CVS. They're a large client of ours.
Though.
Well, I think the vision that Larry has, which is a great one, is to turn those minute clinics into what he calls health hubs, right? And health hubs are designed to take care of much more than the typical earaches and skin rashes that somebody walked into a minute clinic for. And one of the visions is to be able to bring in specialists via virtual care on our platform into the health hub so that you can massively expand the scope of what can be delivered in the health hub.
Okay, so let's say we were, turn back history. We had cell phones of, say, 5G cell phone when I was born. Would my mom never have had, I mean, it seems like a doctor's place is the worst place to go. Would we have been thinking when I was growing up, you know what, it's only for emergency purposes. Everything else should be telemedicine.
Well, what used to happen, right? What used to happen is the house call, where the doctor came to you.
That used to be when I was a little boy.
So that was the house call. The house call avoided that situation. What we've done is we've delivered the house call. We've just done it virtually.
You put the house call back.
That's right.
You know, it's funny. That's how I have to look at it. Because I was old enough to remember when the doctor would come. I think the vast majority of our people, or our viewers, didn't know they even did that. This is a better way to get medicine because of how many illnesses are transmitted in rooms.
That's right, exactly. Delivering care for the consumer on their terms in their home so that they don't have to go out into some other office.
Well, I didn't even get to In Touch. That's my bad. But because of what you said about Shanghai, I just had to, because you're the antidote there, too. I wish they had you in Wuhan.
Well, we wish that we were more prevalent there so that we could make a bigger impact.
Wow. Yeah, you're doing a great job. Okay, that's Jason Gorevic, CEO of Teladoc. You first heard this maybe when we had Lisa Gill on, who's our expert from JP Morgan. Now you see why I like this story so much. Stick with Cramer.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.